Thank you to Allison and Mary for that insightful discussion. With that, allow me to introduce you to our panel focused on the topic of ensuring health equity in climate adaptation and resilience. Amee Raval is the Policy and Research Director at the Asian Pacific Environmental Network, an environmental justice organization that empowers Asian American immigrant and refugee communities across California through local organizing, voter outreach, and policy advocacy. In her role, she has published several reports that are directly influencing equitable climate policy in California. Dr. Shaneeta Johnson is an associate professor of surgery, chief of minimally invasive robotic and bariatric surgery, and program director of the general surgery residency program at Morehouse School of Medicine, Department of Surgery, and Grady Memorial Hospital in Atlanta, Georgia. She is also Senior Fellow in Global Health Equity at the Satcher Health Leadership Institute and Fellow in the National Medical Association Climate Change and Health Equity Fellowship. Dr. Gretchen Goldman is the Assistant Director for Environmental Science, Engineering, Policy, and Justice at the White House Office of Science and Technology Policy. She is on leave from the Union of Concerned Scientists, where she was the Research Director for the Center for Science and Democracy. Dr. Pablo Ortiz is a bilingual climate and water scientist at the Union of Concerned Scientists. Pablo works on developing strategies for vulnerable communities to cope and adapt to the current and projected impacts of climate change, particularly related to water. Dr. Crystal Tulley-Cordova is a principal hydrologist in the Navajo Nation Department of Water Resources Water Management Branch. Her work pre-pandemic focused on protecting and managing water resources in the Navajo Nation. Additionally, since the start of the pandemic, her work has shifted to providing emergency access to safe water for Navajo residents who live in homes with no piped water. And lastly, this panel discussion is being moderated by Dr. Marcia Jimenez, who is an assistant professor of epidemiology at the Boston University School of Public Health. Her research focuses on addressing the influence of geographic contextual factors throughout the life course, including access to green space, on cardiovascular health, cognitive decline, and health disparities. Marcia, please take it away.
Thank you very much, Tia. Hello, everyone. Thank you for joining us. I'm honored to be here today to moderate the panel on ensuring health equity in climate adaptation and resilience. As a co-author of the 2021 Lancet Countdown US Brief, I had the pleasure to work and learn from experts in the field on the unequal harms of climate change and how vulnerable populations are at increased risk of health harms from climate change. In the brief, we learned that decades of racially biased policies create inequities and place individuals and communities who are Black, Latino, Alaskan Native, or American Indian, and other people of color at an increased risk of health harms from climate change. Policies also negatively impact the health of low-income and rural communities and make it harder to adapt to the rapidly changing climate. Relatedly, one of the key messages of the brief was that communities across the United States need support to prevent and respond to the health harms of climate change. It is our responsibility as researchers to try to find climate solutions to address these disparities in health risks. And with this, I would like to start with the first question to all panelists, and please remember that you have 2 to 3 minutes to answer. So reflecting on the 2021 Lancet Countdown US Brief, what do you think is a critical lesson policymakers should be taking into account to ensure health equity is being advanced in all efforts to further climate adaptation and resilience in the United States?
Thank you, Dr. Jimenez, for this opportunity to participate in this discussion. We are undoubtedly facing dire consequences due to climate change. And while all populations and all nations are experiencing some impact of climate change on health and many other areas of their society, this report clearly elucidates the increased impact on vulnerable populations and a response that is inadequate. These populations include those with low resources, the elderly, the very young, persons of color, and many other disadvantaged and vulnerable populations. In the US, we have seen health effects in these communities with increased airborne, foodborne, and other pathogens, increased allergens, the impact on those with low resources by increasing heat and increasing natural disasters. I currently reside in the Southeast, where we have seen increased heat, natural disasters having a profound impact on the health of our region and increasing the burden on our health system. Certainly, my patients have been impacted with increased levels of obesity, allergens, asthma, heart and lung diseases, cancers, and other diseases. So implementing policies to mitigate climate change and thereby affect the health sequelae for all communities and ensure equitable improvement is paramount. To do this, though, we must ensure inclusivity. For far too long, we have excluded or pushed aside the most vulnerable communities and their voices. Without everyone at the table, we cannot adequately address all of the issues at hand and make the impact that is really so necessary. It's been my pleasure to work with policymakers and communities regionally and nationally to encourage these necessary changes. And I encourage our policymakers to reach out to and engage these communities in a lasting manner to ensure that enacted policies have the required impact based on the community's needs. So we must continue to invite everyone to the table in an open and inclusive manner.
All right. Well, the piece of the piece, the policy brief that I picked up on that I wanted to highlight here was around thinking about climate change as a threat multiplier. As the brief lays out very clearly, we are seeing more and more evidence of the impacts of not only health impacts broadly in the community, but also the deep inequities that exist in who is experiencing those impacts. And that climate change is affecting more and more parts of more and more geographies, more and more sectors of the economy, and more populations. And so what I think the big takeaway for decision makers here is to really think about how do we address those inequities, because we cannot tackle this climate crisis without while leaving people behind. What we really need to do is advance and address those inequities. And so who is most affected and who is most vulnerable to the effects of climate change. And as you've been hearing today, that's many of the same populations that have been long disproportionately impacted by pollution and other environmental stressors for decades. And so we need to not only address what the current threat of climate change, but how is climate change making worse a lot of those impacts that we're seeing or other kinds of stressors that are affecting people's health and vulnerabilities. And so the Biden-Harris administration is considering tackling the climate change as a top priority. And we're looking at a lot of different elements of this. And a lot of these necessarily do focus on tackling these inequities and addressing all of these new threats as they touch different parts of our economy and our country. And so one way that we've been doing that is thinking about, how does this play out for each federal agency and each area that they focus? Because this is not something that can just be handled by one agency, one part of the government. We need everyone to have a seat at the table. We need communities to inform the best strategies for addressing these issues. And we really need to think whole of government when we're looking at this challenge. And so when I look at this policy brief, I think about how do we really think about all those issues in the context of policymaking, and how can we really address the inequities in addition to tackling the overall problem of climate change. And to do that, we really need everyone on board.
Thank you. We have been saying that we are running out of time, no? But this report and many others make it evident that many people ran out of time even decades ago. And this report focuses on equitable health risk of climate change, which means that the most vulnerable are being hit sooner and harder. And the critical lesson for policymakers from my perspective is that investments are often not going to the right places. And initiatives targeted at reducing the equity gap must start by the most disadvantaged first. So future grants, projects, all of these initiatives needs to target the most disadvantaged first. And this, of course, is not an easy task because people living in disadvantaged communities often don't speak English, don't have time to engage, don't know that these programs exist, or don't have the expertise, experience, or resources to apply for funding for their households or their communities. So policymakers need to bring more social scientists and community leaders with the task to reach these communities and understand what are their main challenges, because while communities are very similar, they are not the same. And also they need to identify those in most need of help to invest and implement these projects. And policymakers also need to do this fast because we are talking about our essential but invisible workers. And essential but invisible workers that we saw particularly during the pandemic. And in the case of California, they were harvesting our food even while wildfires and really poor air quality was all around. So we are talking about these invisible workers that are risking their health and their lives for producing the food and packaging the food that we all consume.
Great. As a representative of a grassroots environmental justice organization, I think reviewing the report, one of the key takeaways, I think it just reinforced much of what we know, as folks have already shared, that the impact of climate change does not affect all communities the same, and that the multitude of climate disasters and impacts our communities are experiencing are hurting frontline communities first and worst. And in that sense, when it comes to what policymakers can do to respond with solutions, traditional models of sort of response are proving deeply inadequate for our communities. In many ways, one of the key recommendations around building resilience to me really pushes to bridging climate mitigation and adaptation, that we both have to address the root causes and reduce emissions at the source, but also realize that the effects are already in motion and we need to protect communities now that are experiencing the impacts and are being burdened not just by climate disasters, but by economic inequality, by health crisis, and other cumulative impacts. And so there's a real need for holistic solutions in that sense that address the multitude of crises and impacts our communities are facing. So not just with the sort of narrow climate lens, whether that be around emissions reductions or carbon sort of addressing carbon emissions, but also building social cohesion and economic and workforce development and public health responses. And so what are the ways policymakers can really think more broadly across sectors to deliver solutions that really meet community needs in this moment across both climate change and broader social, economic, and health impacts?
It's important to understand the climate change impacts for Native American tribes and Alaska Native villages and underrepresented communities in rural America have exacerbated challenges. Therefore, there's not one standard recipe for addressing health equity in these communities. The COVID-19 pandemic and its discordantly harsh impact on Indigenous people, including the blatant reality of a historical lack of access to essential services and healthcare, are now well known. Water haulers and public water systems are vulnerable to climate change impacts like drought, And black swan events like the pandemic coupled with climate change impact increase health risks. There is a crucial need to understand climate change impacts regionally throughout the United States, to proactively plan climate adaptation strategies and resilience in the U.S. It's critical for policymakers to be proactive when creating policy rather than being reactive. And it's important to have understanding that there is literature available when policymakers are creating new policies to address climate change adaptation planning as well as mitigation strategies. And it's important to think of things like engaging early and often in decision-making processes with the populations that are often underrepresented in these processes. And also it's important to consider increasing co-management of natural resources, and rather than considering the paradigm that currently exists, while also providing adequate funding for climate change adaptation. Oftentimes, with changes in administration, this funding can change as well, but also increasing coordination among federal partners so that financial and technical resources are more easily accessible. Recognizing the interconnectedness of systems and consider strategies that are able to achieve multiple objectives. By increasing partnerships across jurisdictional boundaries and at different scales, and integrating climate change consideration, this helps the policymakers be able to create sustainable policies that are proactive and not reactive.
Great. Thank you very much, everyone, for your thoughtful answers in this great discussion. Now, Dr. Goldman, if you can please talk about how can the work that you and your colleagues at the White House Office of Science and Technology Policy are doing to advance climate science, empower and inform community-led climate adaptation and resilience building efforts?
Thank you, Dr. Jimenez. I'm really glad you asked this question because as we've been discussing here, we need to make sure that solutions are working for communities. And at the Office of Science and Technology Policy, we're obviously very focused on the science and thinking about what's coming down the road in terms of science and advancements. But we know that the science is not enough. We need to make sure we can apply that to making sure that translates to protecting people from the worst impacts of climate change, to really put science to work for mitigation and adaptation efforts. And so we're doing a lot to think about those kind of challenges and make sure that they are responsive to what communities need, and trying to make sure we really are centering those inequities that we've been discussing. And so one of those things you heard Allison Crimmins earlier talk about the National Climate Assessment and the efforts that are underway there. One part of that is going to be highlighting success stories and storytelling from communities to make sure that we can learn from communities that already have put in place some solutions and some efforts that others could gain from. So I think that is a key component of what we're doing. And we're also looking at other ways of how do we really tackle the climate crisis at the community level. The president's promised to listen to the science and work with agencies to look across programs and policies, from cleaner transportation to working globally to cut emissions, to ensuring that communities are more resilient to the worst impacts of climate change. So that's happening in a lot of different ways. There's a national climate task force that is inclusive of agencies across the government that's doing a lot of work and thinking about this in a different way, and trying to really advance and think about what are sort of new things that we haven't done before at the government level to think about how to advance this issue. And I wanted to highlight one concrete example that I thought was a really good case of the kinds of changes that we should be thinking about and improvements that we could be making in different parts of policy decisions. So FEMA, the federal agency, just did an analysis to look at, what are things they could do right now in the short term to really affect change on the ground in their disaster response efforts. And so they did an assessment and identified several things that they could do quickly and implemented them directly. And so one of those challenges was reaching underserved communities when a disaster strikes. So these are communities that they often have a harder time reaching in the wake of disasters. So this could be people, for example, that might not have the necessary paperwork to prove that they live where they live. So proving occupancy or proving ownership of houses can be a barrier for many in accessing a lot of the services and federal aid that you get in the wake of a disaster. And so they identified several things they could change to lower that hurdle to really make it easier for people to qualify for that assistance from the federal government. And they impacted that. They made changes to whether you could get federal aid for mold remediation in the wake of a disaster, since that's often a big impact on people after flooding events. And previously it wasn't always able to be funded. So now that is, and they've already given out millions of dollars in the wake of recent disasters, such as the recent hurricanes, the Western wildfires, the Tennessee floods. And so all of these changes to their programs are already in place, and they were able to reach way more people at a higher rate than they normally have been in the past. And so that little policy change, or seemingly small policy change, has already resulted in huge, meaningful impacts for people on the ground, for disaster survivors. And so as we look to the future and we think about the prospect of more and more climate-linked natural disasters, these are the kinds of things that we can be thinking about and really working to improve how we can serve people and how we can improve health across the board for climate-related threats that we know are here or are coming. And so that's one example, but we're working on lots of efforts like that. And I'm really excited to have this conversation and talk about the ways we can link that with community needs.
Great, thank you very much. The following question is for Dr. Tulley-Cordova. How is climate change exacerbating water access issues in the Navajo Nation and other Native American communities? And what's needed to ensure universal access to safe running water? Please.
Yes, thank you. The Center for Disease Control and Prevention advised to prevent the spread of the germs during the COVID-19 pandemic, you should wash your hands with soap and water for at least 20 seconds. However, when you come from a household that does not have pipe water in the home, this makes it challenging. The pre-existing clean water access gaps and water quality challenges in Native American tribes and in Alaska Native villages are now more significant than in non-pandemic times. In the Navajo Nation, almost 40% of our households lack access to clean water, a huge gap that would not be tolerated in other communities. Domestic water haulers and public water systems, dryland farmers and irrigators, ranchers, wildlife, recreation, and forests are all vulnerable to drought across the Navajo Nation. The Navajo Nation is reliant on groundwater sources. However, continued drought conditions have impacted shallow groundwater levels and water accessibility for humans and animals. Many of the natural lakes and earthen dams are dry. As a result, there is an increased water demand placed on groundwater wells. The Navajo Nation has experienced extensive impacts attributed to both long and short-term drought. This unprecedented time is an opportunity to ensure universal access to safe running water. The 2021 Infrastructure Investment and Jobs Act and the Build Back Better bill can deliver the funding needed to fulfill the nation's responsibility to its first citizens. It is imperative that this financial support be provided, but Providing funding itself is not sufficient. The federal government must commit itself to delivering clean water throughout Indian country and must put in place the mechanisms required to ensure this happens. Access to safe and clean water must be made available now, and promises must be kept and access provided to the most basic of human needs, clean water.
Thank you very much. That was fantastic. The following question is for Ms. Amee Raval. Could you please talk to us about, so the U.S. brief shows that people of color and low-income communities face a disproportionate burden from climate health harms. And as policymakers across the country work on climate adaptation and resilience, how can local knowledge best inform those efforts, in your opinion?
Yeah, thank you for that question. As I mentioned, we at the Asian Pacific Environmental Network are building power and organizing specifically Asian immigrant and refugee communities that are living on the front lines of pollution and of dirty industries. And so I want to reiterate that for environmental justice communities that have been plagued with the burden of our polluting industries for generations, there is nothing really new about cumulative health burdens. The climate crisis is pervasive. And for many communities, it's felt daily, not just during times of disaster. Therefore, we are really pushing for, as folks have raised, community-driven solutions. Through historic disinvestment and deep systemic failures, our communities have had to be incredibly resilient. And now they are organizing for change and innovating local models for crisis response. When disaster strikes, we see time and time again, communities come together, protecting each other and rebuilding together. In some places, neighbors have formed mutual aid networks to share their resources. Schools are providing food to families, and public libraries are turning into cooling and air respite centers. However, without proper investments and resources, there's only so much our overburdened communities can do, especially in the face of converging crises. So I want to uplift one model that really demonstrates what that sort of community-driven social investment in infrastructure looks like. We've been really advocating for community resilience hubs, which are the transformation of trusted buildings like libraries, youth and senior centers, or health clinics, as well as many other community institutions, into facilities that offer space for folks to gather and access services, not only times of crisis, whether it's the pandemic or climate disasters, but on a daily basis for preparedness and recovery and broader community development. Community resilience hubs make possible a wide range of investment simultaneously, whether that be improved insulation to protect people from extreme heat, clean energy installations like solar and storage for backup power during power outages, or air filtration systems and energy efficiency to combat wildfire smoke. And so we have local models that we're actually partnering with in Oakland and in Richmond to demonstrate what this looks like. And we're pushing for resources both at the state and federally to enable these community-led solutions. And fundamentally, these facilities aren't just about the sort of physical infrastructure, but as I've mentioned, the social cohesion, the organizing, the power building, the services, and the programming, all of the sometimes invisible elements that are really the make or break for communities of whether they have protection and support in the face of all that we're experiencing. And so we really are pushing this model as one that can build our community's ongoing resilience during everyday conditions, and fundamentally are really led through a community-led visioning and design process.
Thank you very much. This question is for Dr. Ortiz. Last year, you co-authored a paper with recommendations for how different levels of California government could better prepare for drought and climate change. What are the public health impacts of the climate and water crisis, and what lessons do you think are most important to ensure disadvantaged communities have the resources they need to respond? Oh, I think you're muted, Dr. Ortiz.
Sorry, thank you. Yes, I was saying that public health impacts from the water crisis and droughts are diverse and complex. And these include nutrition-related effects that lead to food insecurity. And this is because droughts decrease crop nutrients and crop yields, rising food prices and creating shortages in low-income communities. Droughts, of course, are also related to water diseases because lower water availability and warmer conditions facilitate the growing of bacteria like E. coli, also of algae blooms, or increases the concentration of arsenic and other contaminants, for example, in groundwater. Also, airborne and dust diseases like valley fever or cancers and asthma as consequence of dust particles that carries pesticides and other products used in agriculture and that they fly into nearby communities. Droughts are also related to more vector-borne diseases like dengue. Mental health effects are another big concern that has taken the lives of farmers and farm workers that lose their crops. And just the impacts of not having water is a huge driver for stress and anxiety. Also, droughts are related to other health effects, derived from the way droughts facilitate other climate events like wildfires or the loss of green spaces and impacts to infrastructure. And one of the problems is that documentation of these health effects of droughts is extremely hard and extremely difficult, considering how droughts often don't have like a clear beginning and don't have a clear end. And also because the effects or the impacts tend to accumulate over time and often be attributed to other related events, like wildfires. And the lesson here is that community engagement is vital, as well as listening and learning firsthand from community members. And a big lesson is that multiple inequities need to be addressed at the same time. And for example, before the pandemic, we did a series of interviews and visited disadvantaged communities, and we thought that water was their main environmental concern. So the people that we interviewed were like, well, yes, water is bad, but air quality is really bad. There are no parks. Education opportunities are poor. There is no fast speed internet. There are no street lights. There are no sidewalks. There is ineffective public transportation. The closest grocery store is that one in the gas station. And the lesson learned is that we may as well address the water or an air issue, and still we want to substantially improve the living conditions in disadvantaged communities without fixing the rest of the system.
Thank you very much, Dr. Ortiz. And last but not least, this is a question for Dr. Johnson. Last year, you co-authored an article in the Lancet about how COVID-19 highlights racial inequalities. What are some of the parallels that you see between how the COVID pandemic and climate crisis exacerbate racial inequalities in the United States?
Thank you, Dr. Jimenez. The COVID pandemic and climate change crises have many parallels, and both crises have served to elucidate and exacerbate the racial inequities that we're seeing in the U.S. It has been quite alarming to view these inequities demonstrated quite shockingly during the COVID pandemic, where communities of color had higher rates of morbidity and died at a much higher rate than their counterparts. Unfortunately, we've seen this time and time again in cancer, mental health, and infectious diseases, to name a few. We are now tracking these data within our health equity tracker to then utilize this data for community-based solutions. These inequities occur in part due to systemic and structural racism, biases, inadequate access, and social and political determinants of health. Similarly, these vulnerable populations are again shown to suffer from inequities that the climate crisis has exacerbated. Lack of education, as well as access to care, resources, and unequal social and political determinants of health show similarities with both the COVID and climate crises. So the COVID pandemic served to spotlight the inequities that we had been fighting for many decades. We are aware of poor access to care, lower rates of insured care, poor access to transportation, housing, and adequate nutrition and water sources due to social and political determinants of health. The climate crisis has borne a similar impact on these vulnerable populations and demonstrated the deepening of racial inequalities. Our communities of color have poor access to safe water. They have increased exposure to airborne pathogens and allergens and are more likely to live in areas affected by natural disasters. They're more likely to live near energy plants, highways, and other unsuitable regions. Still, due to lower income and lower resources, they have greater difficulty with relocation to safer areas. The racial inequities and climate change have a severe impact on the health of these vulnerable communities. And it's really imperative that we continue to work towards our goals of climate change to make an impact for all, and especially for those who are the most vulnerable.